Hi, this is Jacqueline Ecker, and I'm the founder of Eating Disorder Hope. And today I am delighted to be interviewing a colleague who I admire, Lisa Arroyas. She is with Reasons Treatment Center in California. They specialize in eating disorders. We are big fans of Reasons and have been for years here at Eating Disorder Hope. They've been generous sponsors helping us to do all the outreach we do. And we deeply admire their quality of care and how in-depth their treatment goes. So with that, I'd like to introduce Lisa and have her tell us a little bit about herself.
Sure. Thank you, Jacqueline. My name is Lisa Arroyas. I'm the Director of Clinical and Nutrition Services for Reasons Eating Disorder Center. I've been with Reasons since 2007. To back up a little bit, I started college wanting to become a dietitian in the sports field. I was doing a lot of bodybuilding competitions at the time. And my focus was to utilize my passion with that and become a dietitian and work with athletes. So when I started my undergrad, I also needed a job at the time. And so I saw on the bulletin, on the Student Dietetics Association bulletin board, a job posting for a diet technician at a eating disorder facility for adolescents. And at the time, I had no idea or no clue about eating disorders, just the basics. And so I thought to myself, hey, this would work in my school schedule. This could be helpful for me. So I interviewed for the job. I remember even pulling up to the house where the interview was at, running into one of the trash cans because I was so nervous. No one saw me, but eventually I did get hired, and they told me afterwards that we saw you run into the trash can. That was really the reason why we hired you. So, but I will never forget that moment because that changed my whole career. Thinking I want to work with athletes, I knew what I wanted to do. And then I started it at this eating disorder facility treatment center. And it just changed my whole outlook. It changed my career path. And of course, here I am today as one of the directors at Reasons. And I will never forget, and I truly appreciate being hired, because if I wasn't hired for that position, I might not be where I'm at today. So that's how I started out in the field. And I, again, often say the field found me. I wasn't looking for it. So I feel like this is my passion. This is where I should be. And it feels good.
Wow, we are so fortunate that the field found you. And I imagine even with your prior focus just on athletes, you've dealt with a lot of athletes over the years in treatment of eating disorders.
Absolutely. Being an athlete myself in the past, I mean, there is some form of disordered eating, I feel, and that athletes struggle with, and so really understanding that, not at the time, I didn't understand what that truly meant, but really understanding that there's a lot of different populations that struggle with this disease, and just wanting to be part of the healing process to help our clients, our patients.
Absolutely. And it sounds like you have a gift in being compassionate and caring and wanting to help people get unstuck from the eating disorder and move on in their lives and find a life worth living, if you will.
Absolutely. And it takes me back again to my first job as a diet technician, and why I changed my career was really being part of that healing process, really watching someone that came into treatment feeling that there was something profoundly wrong with them, that they should not exist in the world, feeling that they were broken, and watching through like the treatment process, how they were able to connect back to themselves, connect back to life, and not feel broken anymore. It just was a rewarding experience. It's really hard to articulate what I felt at the time, and just why, again, that I changed my whole career path to work with individuals that feel that way and be part of that process.
I love that, Lisa. And it's so hope inspiring, because I know some of the people that have dealt with eating disorders for a while personally, or families, get so discouraged and so burnt out. And yet I hear that passion in you and the belief that people can heal. And that alone, that therapeutic alliance, I think, is so valuable. It sounds like you really provide an environment to meet people where they're at and help them overcome their eating disorder and get on with life.
Right. And we understand, like, this is a complex and complicated disease. And we understand there's a lot of fear. There's eating disorders live in isolation. There's a lot of disconnect, and families, a lot of fear from families. And the individuals we work with, feeling like they can never overcome this disease. We understand that, and we want to be part of that process with them to help them see a different way of life, to help them see that they're not broken and that they deserve to live a higher quality of life, and helping the families go through this as well.
Oh, that just makes me feel joyful. It's just hope and inspiring and so needed. So, what why would I send my daughter, if I had, let's say, a college age daughter who was dealing with anorexia and maybe had some more serious co-occurring issues, which is often the case, to Reasons?
Well, we understand that eating disorders are rooted and driven by anxiety. So, really personalizing treatment and helping someone to understand where that is coming from. On the surface, a lot of times you hear, okay, the diagnosis of anorexia, oh, it's about the food. They're restricting, they're not eating. And we often will say it's not about the food. What is driving those behaviors is on a much deeper level. So, really helping someone to almost pull back the layers of that, helping someone heal through that process of connecting back to food and to their bodies, and then understanding what is happening on a deeper level.
Yes.
And we are a program that is heavily based in exposure response prevention. Exposures is the approach that we use to help someone heal through this process, to understand it's not just about the food, and to help them to manage their anxiety and distress around food, or it could be around other things too, around social anxiety, around, various situations. So that's why exposures are really helpful with this. It's really identifying what exposures are needed, what is causing this anxiety and distress that you feel you have to do these types of behaviors in order to function in life, and really look at, again, what is truly happening underneath.
Oh, that's wonderful. So even if I'm an individual who's had a severe anorexia and eating 4 foods for the last 2 years, you're telling me there's hope that I could expand my diet and actually not be driven by those restrictions anymore? That's possible. Sometimes it doesn't feel possible for the sufferer.
And we understand that. And it may not feel that way, but 100% it is possible. And that's what, being at Reasons and working with a multidisciplinary team, we are in it together. We always say the patient is the most important part of the treatment team. And we understand it feels like it's impossible, but we are here to show you that it is very possible. And through this various, I talk about exposures and the other approaches that we use, that is the goal, is to help someone to see that for themselves and to really help to guide and support them along the way.
Wow, that's really hope inspiring. Just that one could get past that and enjoy food again and be connected with their body, and find the tools and maybe trust the staff enough to work on some of those deeper issues that are driving it. And how miraculous, really, when you think about it, because the people that come into treatment at Reasons and do that deep work could be changing family dynamics for generations. It could impact so many around them, let alone change their own lives.
Right, absolutely. And again, this is why I have a passion for eating disorders, is having the privilege to be part of that healing process, to help changing someone's life, to help change the family dynamics. It inspires me.
Yeah, it inspires me too. So, what kinds of levels of care do you offer in general, and how does that work for students or moms or, guys that are dealing with stuff?
Yeah, we first I want to say we're an all gender inclusive program. And we have 4 levels of care. We have our inpatient level care, which is our highest acute level, and it's based in a hospital. And then we also have residential level of care, and then we have PHP and IOP levels of care. And because we are based in a hospital, we are connected to a psychiatric hospital. So we have the capabilities of help treating a lot of individuals that have higher acuity. We have patients that might be higher, like psychiatric acuity. After COVID, especially, we have seen that, individuals are struggling more, whether it be with their eating disorder or with like other co-occurring disorders. And so we have the capabilities of helping to treat the higher acuity because we can help to keep someone safe.
Yeah, that's a gem, because I know many of the treatment centers in the country are not able to deal with high acuity cases and more in-depth psychiatric issues. And that is so important to address, even if it's just getting medication corrected, because some long-term eating disorder sufferers need to kind of go back to ground zero to get on the right track.
Right, absolutely. And in our inpatient level of care, we can manage those medications on a daily basis. We have our director of medical services. He's our psychiatrist. And so he can monitor any medication changes or needs on a daily basis.
Oh, that's lovely. And I was looking at your website, and you have some really nice houses that are residential, and they look more home-like too, for someone who wants to be at a residential level of care. What are those like?
Yes, so we have 3 residential locations. We have, our first one was Pasadena.
Yeah.
And also we have 2 other ones in San Marino and also Arcadia. And so these are 6. Oh, sorry.
I'm sorry, you said 6. That was going to be my next question. Like, how many people? What's mealtime? What is mealtime like there? That sort of thing.
Yeah, they're 6 beds. Our Arcadia location is all genders. And as far as mealtime goes, it's a kitchen approach. What I love about residential, I love all the levels of care and the types of exposures that you can do. Yes. And what I love about residential is that kitchen exposure. So we are a program that, we want to help bring in real situations that you struggle with, so we can help you to, again, manage the anxiety, build other skills, so you're not having to do the compensatory behaviors. And so the kitchen exposure is really valuable. We have our patients hands-on, prepping in the kitchen, really focusing on connecting back to the food. A lot of our patients might have had trauma in the home or in the kitchen, or don't want to connect to the food. So they get that exposure or that experience through the residential level.
Oh, that's so cool. I had an eating disorder, went through treatment. They didn't offer anything like that. And that would have been so meaningful. And then PHP and IOP, can you just in general explain to folks what that means and how that might make them able to maintain some of the responsibilities in their life, if that is a suitable level of care for them?
Right, and that would be obviously assessed through our admissions process, but the PHP and IOP levels of care, so we do it through virtual services. And so oftentimes it's helpful for someone that maybe is still in school, or someone that has to work, and they're able to do treatment at the comfortability of their own home. And so we provide the same treatment with all the multidisciplinary team members, use the same exposure approach that we use through the virtual services. So that can be helpful for someone, again, that maybe has other things that they need to manage in life, or needs more practice with like more accountability type of exposures of being in an outpatient level of care.
Yeah, that makes complete sense to me. And then, is there any kind of support after somebody gets out of treatment? Do you help them find a team if they don't have one? Do you work with their team? How's that work?
Absolutely. So the ones that come into our program that already have an outpatient team, we most definitely will be connecting with them. The RD will connect with the outpatient dietitian. The therapist will connect to the outpatient therapist, and make sure that they're in communication and getting the updates that are needed for their client. And then the ones that don't have an outpatient team, we will provide referrals and help someone to find a team prior to discharge.
Oh, that's lovely. That's absolutely essential to have that hand down so you're not just dropped out of treatment, which it was more
Absolutely.
like that back in the day when I went through treatment many years ago. It was like, okay, you're on the street.
Right. Yeah. See you later. You're done. No,
Yeah.
actually, we will set up not only the outpatient team, but also provide like support groups. We have an alumni group that is offered once a week. And then there's various other support groups that we could also recommend and provide to the patient before they discharge. I mean, the whole idea is to help set up a support system prior to discharge, not just like you said, okay, you're done with treatment, see you later, you're on your own.
Yeah. So it sounds sustainable that, I mean, the levels of care, the ability to treat highly acute cases, and then sort of a capacity to step down. And I assume you could be in the alumni group as long as you want.
Absolutely. Absolutely. And sometimes, people that have been in our alumni group find that, they start to struggle again and they may need treatment. And so we'll help them to coordinate that care as well.
Oh, that's so lovely. I'm so glad you brought that up because I think, as you mentioned, these are complex cases and it's rarely like a straight line of recovery. Sometimes we fall
Right.
back, especially with major life changes, and that's okay. It's
And
part
that's
of the
okay. Exactly.
journey. Have you,
Right. Yeah.
can you talk about that or what you've seen with people where they came back to treatment, but then
Mhm.
it was a stepping stone to move further ahead in their life?
Right. I mean, like you mentioned, it's not a linear process, right? And it's very common and it's okay. And it's normal if someone maybe discharges from our treatment center and finds themselves struggling again, because there are difficulties in life and we understand that. And we're here to help to support you no matter how many times that you have to come back, and just really normalizing that for someone. And again, saying it's okay. It's absolutely fine.
Yeah, no judgment, and for them to bring that compassion to themselves. And I'm here to tell you, I mean, I'm 56. I had an eating disorder that started manifesting at 13. I was very, very sick. And my eating disorder recovery was 2 steps forward, 1 step back,
Mhm.
constantly for many years. But all of it taught, actually gave me more fortitude, more compassion for others. And I think I'm stronger because of it. There's never a give up point. That doesn't mean
Right.
that you aren't still even making progress. And I love the idea. I remember this therapist always saying to me, you know what? I'd be like, I suck. I haven't done it right. I just binged again or whatever. And she'd be like, but how far have you come? Let's look back, and it's a process in our souls and our characters evolving, and it's okay. We don't have to do it perfectly.
Right, is exactly. And we've had the same, types of patients that, oh, I suck because I'm back here for the, second, fourth, 10th time,
Yeah.
and then really helping them to look back and or reflect back on look where you're at now. Yes, you're struggling and that's okay, but it doesn't mean you're back to square one, that everything, all the work you've done has been erased.
Yes.
And oftentimes they realize they're more resilient than they recognize because they
Yeah.
had the courage to come back. They had the courage to say, I need the help. And again, that takes a lot of courage. And we commend that and we validate that.
Me
And I'm
too.
always impressed by it.
That's awesome. So I know that you guys take TRICARE, which I'm excited about because at Eating Disorder Hope, we hear inquiries for TRICARE all the time, and a lot of places don't offer it. But also, just what's the insurance benefits process like to go to Reasons?
Yeah, we take various insurances, but you did highlight an insurance that we do take because I know other places don't, a lot of other places don't accept TRICARE. So
Yeah.
we have a lot of military patients coming in. So most definitely, take various insurance, where I'm looking for.
Yeah, yeah. So I know you guys do that. You take a lot of the major carriers, and that you have an admissions team that helps people and walks them through it, and they can call. In fact, I'd like to share the number of reasons for people to call if they have an interest in learning more. And You can call admissions and speak with someone about treatment or your questions about care at Reasons at 844-573-2766. You can also look up Reasons Eating Disorder Center at Reasons and then edc.com.